Hi everyone, in my presentation we are going to be focusing on postpartum recovery and the role physical therapy plays in helping women recover after childbirth. So to start, many women experience physical changes following pregnancy, which can impact their strength, mobility, and even daily activities. The goal of this presentation and stimulation is to explore how the core strengthening, pelvic floor rehabilitation, and mobility exercises can help women regain their physical health after childbirth. So, diving into the stimulation overview, after giving birth, women may experience reduced core strength, pelvic floor dysfunction, and limited mobility, which can make daily tasks like bending, lifting, and walking even more difficult. Beyond the physical challenges, there are also psychological impacts as well, such as fatigue and emotional strain. In my stimulation, I'm going to explore how physical therapy can help improve strength, pelvic floor function, and mobility, which are all very crucial for postpartum recovery. So to get up into the warm-up and core strengthening, we are going to start with some core strengthening exercises. These exercises are essential for rebuilding the strength of the muscle that support the spine and the pelvis after pregnancy. The first exercise is going to be a modified plank. So we will begin on our knees with our hands under our shoulders. We will engage our core and hold for 10 to 15 seconds, repeating this for 2 to 3 sets. The next exercise is going to be a bridge. So this will be lying on your back with your knees bent and feet flat on the floor or the table. You're going to lift your hips towards the ceiling, hold for a few seconds, probably about 5, and then lower your back down. For this exercise, we also want to focus on engaging your core and try to keep the movement slow and very controlled. Pelvic floor rehabilitation is another critical part of postpartum recovery. Strengthening the pelvic floor muscles helps prevent issues like urinary incontinence and pelvic organ prolapse, which can affect many women after childbirth. One simple exercise to start is Kegels. To do Kegels, contract the pelvic muscles as you're stopping the flow of urine, hold for 5 seconds, and then release. You would do this about 10 times. Another exercise is pelvic tilts, so you would be lying on your back with your knees bent and tilt your pelvis upward while keeping your lower back on the floor. You would hold this for about 5 seconds and then relax. It is very important to isolate these muscles and take deep breaths during all of these exercises. Let's now look at some mobility challenges women may face postpartum. Simple daily tasks like lifting a grocery bag or bending over to pick something up can be very difficult. For the first challenge, stimulate lifting a grocery bag by engaging your core and bending at the knees to lift this weight. This helps protect your back and reinforces proper lifting techniques. For the second challenge, practice bending to pick up an object. Again, remember to bend your knees and keep your back straight to avoid a strain. Now, think about how these tasks would feel if you were postpartum. What would help support you? This exercise helps practice movements safely and very effectively. So to wrap up the stimulation, we would do a cool down exercise to release any tension in the back and pelvis. A really great cool down stretch is the cat-cow stretch. So for this stretch, you would get on all fours and alternate between arching your back and lifting your chest up. This motion will gently stretch and relax your spine, hips, and pelvis. So as you do this, I would think about how these exercises felt. Did you notice any challenges in your mobility or strength? And also remember, postpartum recovery is different for every woman, but these exercises can be a very valuable part of the rehabilitation progress. So in conclusion, postpartum recovery is an important process for every new mother. It is not just about regaining physical strength, but it's also about improving emotional well-being and overall quality of life. By focusing on core strengthening, pelvic floor rehab, and mobility training, we can help women address common postpartum challenges and prevent long-term issues. Physical therapy plays a crucial role in supporting women's health during this time of recovery. Now I'll show you the exercises that we talked about earlier. These exercises are all able to be done at home, and they're a great way to start working on postpartum recovery. So make sure you perform each movement slowly and focus on your breathing the whole time. This first exercise that we're going to do is going to be a modified plank. You would hold it for 10 to 15 seconds and do 2 to 3 sets. Hold it for a second. Okay, good. This next exercise is a pelvic tilt. So pelvic tilts are to further strengthen in the pelvic region. And in this video, we are lifting our pelvis up and keeping our back towards the ground. For this next exercise, it is going to be the bridge exercise for pelvic and core strengthening. So we are holding that bridge up for about 5 to 10 seconds and then controlling coming back down. The last stretch that we're doing is our cat-cow stretch. So this is our cool down stretch to be done after the rest of the stimulation. All right, good. Lastly, here are the references I used for this presentation. These sources provide very valuable information on postpartum recovery and the role of physical therapy in helping women regain their strength and mobility after childbirth.